Namaskar. Myself, Dhanya C P. I am professor in Department of Swasthivritta and Yoga, Ashtanga Ayurveda Chikitsalaya and Vidyapita, and I practice preventive, community and social medicine in Ayurvedic health discipline. We know that dietary habits and lifestyle of an individual have transformed in the past 10 to 15 years, and it is reflected as a rise in the global health statistics of lifestyle disorders or non-communicable disorders. But today, I don't want to go to non-communicable diseases and diet. I wish to highlight the dietary corrections in a disease called as IBS, which is a very common disease nowadays. A lot of people are approaching healthcare practitioners and we are getting a complete diagnosis of IBS. Unfortunately, a lot of people are suffering from the symptoms of IBS and they are not getting diagnosed also. So IBS is a chronic common disorder affecting the stomach and intestines. It is essentially a functional disorder. It is not a structural disorder. So usually nowadays we confuse with IBD and IBS. People, common man can confuse with IBS and IBD. IBD is resulting in an inflammation of the intestines and it may eventually develop to structural deformities. It may or may not. It is an overexcited immune response, IBD. But in IBS, what is happening is a stress response is evoking some functional imbalances. That stress response may be due to a gastrointestinal infection which an individual has conquered recently, or it may be due to his faulty dietary habits or environmental factors or psychological factors. Simple day-to-day stress might have accumulated in such an amount that it is reflecting as an abnormal functional disturbance in his gastrointestinal system. So understanding IBS in terms of Ayurvedic principles and practices allow us to treat it as Grahani Roga. Derangement in the bioenergies with the three doshas, Vata, Pitta, Kapha, the tissue metabolism and the metabolic pathways, the psychological, neurological, excretory systems, the dietary functions and the gut health functions. All these factors are interconnected and the pathological process, functional imbalances in all these result in Grahani Roga. So when we manage Grahani Roga also, we will be considering these imbalances of bioenergies. And the effect of these imbalances of the bioenergies in whatever I have told now, like tissue metabolism, metabolic pathways, psychological, neurological, excretory functions and the rest. Common symptoms of IBS which can be equated with Grahani Roga include altered bowel habits, predominantly of a constipating nature or a loose stool nature, changes in the frequency of passing stools, foul smelling stools, pain or burning sensation depending upon the dosha involved. Along with these excretory symptoms, one may even experience bloating, loss of appetite and fatigue. Symptoms vary from person to person depending upon the prakriti of a person or the general characteristics of his koshta or what we call as the gastrointestinal tract or the environmental factors in which an individual is living. Therefore, the dietary management or a dietary correction when we are advising in Ayurveda, it should be customized and personalized. So when we advise dietary corrections in Ayurveda for an IBS patient, we will be analyzing three things. First one is the imbalance of the predominant dosha involved in the particular pathology of that specific individual. Second one is his symptoms are constipation predominant or a loose stool predominant style. And third thing is the psychological factors or psychological symptoms in an anxiety pattern or in a depression pattern. So interventions at these three levels will be different. Common dietary articles, what we usually prescribe in IBS include cereal group consisting of ragi or wheat or nyavara rice, protein group consisting of green gram, red gram, horse gram, masoor dal and lentils, protective foods consisting of fruits and vegetables, commonly pomegranate, lemon, leafy vegetables including moringa leaves, mixed vegetables and vegetable soups. Nutmeg powder, ghee, sugar, long pepper powder, etc. are very beneficial for IBS patients. Usually, we prescribe Panajala for IBS patients, that is a medicated water for drinking. You can prepare it with boiling water with black cumin, cumin seeds, coriander seeds, ajwain and dry ginger powder. Instead of caffeinated beverages, you can resort to buttermilk, which has got a very positive influence in IBS patients. Whatever dietary articles what we have advised are light to digest foods with sweet and astringent taste. Usually we follow this pattern unless otherwise the patient is having any other complaints or any other pathology. Specific considerations we will make in the diet plan. For example, we will never prescribe a horse gram if the person's symptoms are in a predominant loose stool pattern. Likewise, the long beans, lentils are also not prescribed if he is having a constipation predominant symptoms. So, special dietary articles for symptomatic management, one example I can tell is nutmeg powder. Especially, we can advise in foul smelling stools. And radish is a very valuable vegetable which we can advise in any stage of IBS symptoms. All these specific considerations we will be making depending upon person specific. So it is better you should always consult an Ayurvedic dietitian for a diet plan. Individually, if you are planning your diet, there are chances that you may lose the daily recommended allowance of some of the specific nutrients. Usually IBS doesn't affect the absorption of nutrients, but some researchers have evidenced carbohydrate malabsorption as a cause for IBS. So in such individuals, we will be considering suitable cereals and we will be analyzing the day-to-day symptomatic aggravations or alleviations, and we will be continuing the diet plan or we will be changing the diet plan on a daily basis. So individuals can also keep a diet diary in which they can also notice the dietary articles which are aggravating their symptoms. And in the next day or in the coming subsequent days, they can reduce the consumption of such dietary articles. If we carefully observe our diet plan and the symptoms of IBS, an individual can design his own diet plan. So if you take this diary when you are consulting an Ayurvedic dietitian, it will be very useful for them also to design a specific diet plan for you. They can avoid all the triggering food items that can exacerbate your symptoms. So food preparations can also include specially designed gruel preparations from cereals depending upon the digestive power of the patient, and meat soups in the initial stages, and day by day increasing articles or preparations which will not imbalance the digestive capacity of the individual. So the first and foremost consideration whenever we plan a diet is the Agni or the digestive capacity or digestive strength of the individual. So a customized diet plan and Ayurvedic management techniques can minimize the effects of IBS and can increase the quality of life of the patient, even if we term it as a lifelong disease. Faulty dietary habits and lifestyle are now seen in even from early childhood, and they are neglecting a daily routine. This can eventually disorganize their life in their adulthood and adolescence. So it has been observed that people who don't have a time management in their adulthood, the first thing they want to skip is their meals. And they resort to untimely meals, outside foods, and more they are involved in eating foods which are of nutritionally less value. And that is the reason for the increased prevalence of IBS in Indian community nowadays. Following an Ayurvedic lifestyle and an Ayurvedic dietary regimen can prevent the occurrence of IBS.